In the world of pharmaceuticals, the science behind the drugs we take can often seem like a complex puzzle. Zafirlukast is no exception. This video aims to unravel the science behind the pharmacology and therapeutic potential of Zafirlukast, shedding light on its intricacies and exploring the ways it can benefit patients. Zafirlukast is a medication that falls into the category of leukotriene receptor antagonists, LTRAs, and it is primarily used for the treatment of asthma. But what exactly does it do? How does it work in the body? And what are its potential therapeutic applications beyond asthma? Through a thorough examination of clinical studies and scientific research, we will delve into the pharmacology of Zafirlukast and explore its potential benefits in other conditions such as allergic rhinitis and exercise-induced bronchoconstriction. By understanding the mechanisms of action and therapeutic effects of this drug, we hope to provide valuable insights for both healthcare professionals and patients. So, join us on this journey as we unravel the science behind Zafirlukast, shedding light on its pharmacology and exploring its potential beyond asthma treatment. Understanding the pharmacology of Zafirlukast. Zafirlukast belongs to a class of drugs known as leukotriene receptor antagonists, LTRAs. These medications work by blocking the action of leukotrienes, which are inflammatory substances produced by the body in response to certain triggers, such as allergens or exercise. By inhibiting the effects of leukotrienes, Zafirlukast helps to reduce the symptoms of asthma and other related conditions. The primary target of Zafirlukast is the cysteinyl leukotriene receptor, specifically the CYSLT1 receptor. By binding to this receptor, Zafirlukast prevents the activation of downstream signaling pathways that lead to airway inflammation, bronchoconstriction, and mucus production. This mechanism of action makes Zafirlukast an effective medication for the management of asthma symptoms. However, it is important to note that Zafirlukast is not a rescue medication for acute asthma attacks. It is primarily used as a maintenance therapy to control and prevent chronic symptoms. Patients with asthma should always have a short-acting bronchodilator on hand for immediate relief in case of an acute exacerbation. Understanding the pharmacology of Zafirlukast provides a foundation for exploring its therapeutic uses and potential benefits in other conditions. Therapeutic uses of Zafirlukast. The primary therapeutic use of Zafirlukast is in the treatment of asthma. It is indicated for the management of both chronic asthma and exercise-induced bronchoconstriction. By blocking the activity of leukotrienes, Zafirlukast helps to reduce airway inflammation, bronchoconstriction, and mucus production, thereby improving breathing and reducing the frequency and severity of asthma symptoms. In addition to asthma, Zafirlukast has shown potential benefits in the treatment of allergic rhinitis. Allergic rhinitis is a condition characterized by inflammation of the nasal passages due to an allergic reaction. Studies have shown that Zafirlukast can help reduce nasal symptoms such as sneezing, itching, and congestion in patients with allergic rhinitis. Moreover, emerging research suggests that Zafirlukast may have therapeutic potential in other inflammatory conditions, such as chronic obstructive pulmonary disease, COPD, and eosinophilic esophagitis. While more studies are needed to establish its efficacy in these conditions, the anti-inflammatory properties of Zafirlukast make it a promising candidate for further exploration. The therapeutic uses of Zafirlukast extend beyond asthma, offering potential benefits in other respiratory and inflammatory conditions. Understanding these applications can help expand its clinical utility and improve patient outcomes. Efficacy and clinical studies of Zafirlukast. Numerous clinical studies have been conducted to evaluate the efficacy of Zafirlukast in the treatment of asthma and other related conditions. These studies have consistently demonstrated the effectiveness of Zafirlukast in improving lung function, reducing asthma symptoms, and decreasing the need for rescue medication. One study published in the Journal of Allergy and Clinical Immunology compared the efficacy of Zafirlukast with a placebo in patients with mild to moderate persistent asthma. The results showed that Zafirlukast significantly improved lung function and reduced the frequency of asthma exacerbations compared to the placebo group. Another study published in the European Respiratory Journal evaluated the effects of Zafirlukast in patients with exercise-induced bronchoconstriction. The findings revealed that Zafirlukast effectively reduced the severity of exercise-induced bronchoconstriction and improved exercise tolerance. These clinical studies provide robust evidence of the efficacy of Zafirlukast in the management of asthma and exercise-induced bronchoconstriction. Further research is ongoing to explore its effectiveness in other conditions and to identify the optimal patient populations for its use. Safety profile and side effects of Zafirlukast. Like any medication, Zafirlukast comes with its own set of potential side effects and safety considerations. Common side effects of Zafirlukast include headache, gastrointestinal disturbances, and liver function abnormalities. It is important for healthcare professionals and patients to be aware of these potential side effects and to monitor for any signs of adverse reactions during treatment. In rare cases, Zafirlukast has been associated with more serious side effects, such as Churg-Strauss syndrome, a rare condition characterized by blood vessel inflammation. However, the overall incidence of these serious side effects is low, and the benefits of Zafirlukast usually outweigh the risks in appropriately selected patients. It is crucial for healthcare professionals to carefully assess the safety profile of Zafirlukast in each individual patient and to consider any potential drug interactions or contraindications before prescribing this medication. Close monitoring and regular follow-ups are essential to ensure the safe and effective use of Zafirlukast. Comparing Zafirlukast with other asthma medications. In the world of asthma management, Zafirlukast is just one piece of the puzzle. There are several other classes of medications available for the treatment of asthma, each with its own unique mechanisms of action and therapeutic benefits. In comparison to short-acting bronchodilators, such as albuterol, Zafirlukast offers the advantage of long-term control and prevention of asthma symptoms. It is often used in conjunction with inhaled corticosteroids, which provide anti-inflammatory effects, to achieve optimal asthma control. When compared to other leukotriene receptor antagonists, such as montelukast, Zafirlukast has a similar mechanism of action but may differ in terms of dosing regimens and potential side effects. The choice between these medications is often based on individual patient factors, tolerability, and response to therapy. Understanding the similarities and differences between Zafirlukast and other asthma medications can help healthcare professionals make informed decisions when choosing the most appropriate treatment options for their patients. Dosage and administration of Zafirlukast. The dosage and administration of Zafirlukast may vary depending on the patient's age, condition, and response to therapy. It is typically taken orally as tablets or granules and should be taken on an empty stomach, at least 1 hour before or 2 hours after a meal. For adults and adolescents aged 12 years and older, the recommended starting dose of Zafirlukast is 20 mg twice daily. The dosage may be adjusted based on individual patient response, but it should not exceed 80 mg per day. For children aged 5 to 11 years, the recommended starting dose is 10 mg twice daily, with a maximum daily dose of 40 mg. It is important for patients to adhere to the prescribed dosage and follow the instructions provided by their healthcare professionals. Regular monitoring and follow-up visits are essential to assess the efficacy and safety of Zafirlukast and to make any necessary adjustments to the treatment plan. Future research and potential applications of Zafirlukast. While Zafirlukast has already shown significant therapeutic benefits in the treatment of asthma and exercise-induced bronchoconstriction, ongoing research is focused on uncovering its potential applications in other conditions. One area of interest is the role of Zafirlukast in the management of chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease characterized by chronic inflammation and airflow limitation. Preliminary studies have suggested that Zafirlukast may have anti-inflammatory effects in COPD, but further research is needed to establish its efficacy in this patient population. Another potential application of Zafirlukast is in the treatment of eosinophilic esophagitis, EOE, a chronic inflammatory condition that affects the esophagus. EOE is characterized by the infiltration of eosinophils, a type of white blood cell, in the esophageal tissue. Early studies have shown promising results with Zafirlukast in reducing esophageal eosinophilia and improving symptoms in patients with EOE. As research continues to unravel the science behind Zafirlukast, we can expect to discover more potential applications and therapeutic benefits of this medication. The future looks promising for Zafirlukast, as it continues to evolve as a valuable tool in the management of respiratory and inflammatory conditions. Conclusion. Zafirlukast, a leukotriene receptor antagonist, offers a valuable therapeutic option for the treatment of asthma and exercise-induced bronchoconstriction. Through its mechanism of action, Zafirlukast helps to reduce airway inflammation, bronchoconstriction, and mucus production, improving lung function and reducing the frequency and severity of asthma symptoms. Beyond asthma, Zafirlukast has shown potential benefits in conditions such as allergic rhinitis, COPD, and eosinophilic esophagitis. Ongoing research is exploring its efficacy in these conditions, paving the way for future advancements in respiratory and inflammatory disease management. Understanding the pharmacology and therapeutic potential of Zafirlukast provides healthcare professionals and patients with valuable insights for optimal treatment decisions. By unraveling the science behind Zafirlukast, we can unlock its full potential and improve patient outcomes in the world of respiratory medicine. Thanks for watching.